Let's break down Alzheimer's disease, a key topic you'll encounter in neurology. Alzheimer's disease, or AD, is the most common cause of dementia among older adults. It's a progressive neurodegenerative disorder, meaning it gets worse over time, affecting memory, cognition, and behavior. Let's dive into the anatomy, pathophysiology, and etiology of this condition. First, let's talk anatomy. The brains of those with Alzheimer's undergo significant changes. The most notable ones are in the cerebral cortex and the hippocampus, crucial areas for memory and cognitive function. These regions suffer atrophy or shrinkage due to neuron and synapse loss. You'll also see enlarged ventricles, those fluid-filled spaces in the brain. On a microscopic level, we identify two hallmark features: amyloid plaques and neurofibrillary tangles. Amyloid plaques are extracellular deposits mainly composed of beta-amyloid peptides, fragments of a larger protein known as amyloid precursor protein, APP. Neurofibrillary tangles, on the other hand, are intracellular accumulations of hyperphosphorylated tau protein, which disrupts normal microtubule function in neurons. Now let's move to the pathophysiology of Alzheimer's disease. It's a complex process involving multiple pathways. The accumulation of beta-amyloid peptides is thought to kickstart a chain of events leading to neuronal damage. These peptides aggregate to form plaques, disrupting cell-to-cell communication and triggering immune responses that cause inflammation and oxidative stress, further harming neurons. Tau protein, which usually stabilizes microtubules, becomes hyperphosphorylated in Alzheimer's, forming neurofibrillary tangles. This disrupts the neuronal transport system, leading to cell death. The loss of neurons and synapses in the cerebral cortex and hippocampus results in the typical symptoms of AD: memory loss, impaired judgment, disorientation, and behavioral changes. Lastly, let's touch on etiology. The exact cause of Alzheimer's isn't fully understood, but it's likely a combination of genetic, environmental, and lifestyle factors. Several genetic factors have been pinpointed, with mutations in the APP, PSEN1, and PSN2 genes linked to early-onset familial Alzheimer's. For late-onset Alzheimer's, the apolipoprotein E, APOE gene, especially the APOE E4 allele, is a major risk factor. Environmental and lifestyle factors also play a role. Age is the most significant risk factor, with the prevalence of the disease increasing dramatically as one gets older. Other contributing factors include cardiovascular health, education level, and physical activity. So, in summary, Alzheimer's disease involves specific anatomical changes in the brain, a multifaceted pathophysiological process with amyloid plaques and neurofibrillary tangles, and etiology that encompasses genetic, environmental, and lifestyle factors. Understanding these aspects is crucial for developing strategies to prevent, diagnose, and treat this debilitating disease. Thanks for tuning in, and remember, knowledge is power.